This is a plain and contrast non-CT scan of paranasal sinuses of a young male patient. His age is approximately 21 years. The patient presented with painful proptosis on right side. Now please observe this slightly hyperdense mass in the posteromedial part of right orbit. This one here. This shows no contrast enhancement. Its CT density is approximately 60 HU. Now I will show you his contrast non-CT scan. This is the contrast non-CT scan. Please observe this proptosis. Now this is the mass lesion here. It doesn't show any enhancement. It shows intraconal extension and comes to lie alongside. This is the optic nerve here. This is superior rectus muscle. There is involvement of the medial rectus muscle, superior oblique muscle. The mass has eroded supromedial wall of right orbit. There is erosion of the posterior part of lamina papyracea, cribriform plate. The mass extends into the orbital apex. Orbital contents and the extraocular muscles, these are not separately identifiable in the region of orbital apex. There is no extension of mass into the inferior oblique fissure. However, the mass extends into the superior oblique fissure. It has eroded optic canal and extends into right sphenoidal sinus. Here the mass is extending into right ethmoidal sinus in this region here. This is crista gala. This is the contrast non-axial scan. Please see these bone erosions. Intraorbital component of the mass, abutting posterior surface of right eyeball and pushing it anteriorly. In this region, the mass has eroded anterior wall of right sphenoidal sinus, and the mass extends into the sphenoidal sinus as well. This is the bone window just to show you the bone erosions. Now please see this. This is the left optic canal here, while on right side optic canal has been eroded. However, there is no intracranial extension of the mass. This is the corneal scan. Mass lesion here, eroding adjacent bones, cribriform plate extending posteriorly into superior oblique fissure, optic canal into right sphenoidal sinus. Sagittal scan. This is the mass here. Eroding anterior wall of sphenoidal sinus and extending into the sphenoidal sinus.